drugs that alter the sodium and water balance of the body. The word is originated from a Latin word diuretic, which means to urinate or to prompt the production of urine. And as the name indicates, these are the drugs that increases the excretion of sodium and water from the body. There are also other substances that are excreted when they are exposed to the diuretics, and it varies according to the type of diuretics, but the major function that all diuretics perform is the excretion of the sodium and water from the body. The antihypertensive effect of diuretics is by reducing the blood volume. It also has a direct vascular effect that is not fully understood, but there is a theory that the sodium increases the vascular stiffness. So when there is less sodium in the body, there is decreased in vascular stiffness, and as a result, there is a increase in the vasodilation, and the peripheral vascular resistance is decreased. So by reducing the water, it decreases the blood volume, and when the blood volume is decreased, there is a decrease in the peripheral vascular resistance, as well as there is a decrease in the cardiac output. And as we know that blood pressure, in order to reduce the blood pressure, we have to keep the formula in our head. The blood pressure is equal to the product of cardiac output and peripheral vascular resistance. So when we decrease the blood volume, we decrease the cardiac output, and when the cardiac output is decreased, the blood pressure is decreased. Similarly, when we decrease the peripheral vascular resistance, as a result, blood pressure is also decreased. So this is how it acts to reduce the blood pressure in the body. So the initial few weeks of therapy, the cardiac output decreases when the diuretics are exposed towards the body or in a body. But after like 6 to 8 weeks of therapy, the cardiac output, it returns to normal, and the peripheral vascular resistance, it decreases, and diuretics, they are used to treat the mild and moderate hypertension with normal renal and cardiac functions. However, to treat the severe hypertension, these are combined with other drugs, for example, sympatholytics or vasodilator drugs, and that is how they're used to treat severe hypertension as well. However, alone diuretics are used for the treatment of mild to moderate hypertension. There are three major classes of diuretics that are used in the treatment of hypertension. Number one is thiazide diuretics. In the thiazide diuretics, we have three drugs: hydrochlorothiazide, chlorothiazide, and chlorthalidone. Among these, hydrochlorothiazide and chlorthalidone are oral drugs, whereas chlorothiazide is also available in the IV formulation. Now, these drugs, they act in the distal convoluted part of the nephron. And if we recall the structure of nephron, you know that there is a glomerulus, and from the glomerulus, here comes the tubule. It comes out of the glomerulus, and there's proximal tubule, and after that there is loop of Henle, and then there is distal convoluted tubule, and it goes inside the collecting tubule. So this is the structure of the nephron. So from this, we have taken this part of distal convoluted tubule and zoom it here. This is the lumen of the urine, in which the urine is present. This is the interstitium, and these are the cells that are present in the membrane of the distal convoluted tubule. So in the distal convoluted tubule, there is a transporter, or there is a channel which is called as NCC. This is sodium chloride transporter, and this transporter is the main target of the thiazide diuretics. The thiazide diuretics interact with this transporter and inhibits the effect of this transporter, and as a result, the reabsorption by the channel, it is inhibited. This channel is primarily responsible for the reabsorption of sodium and chloride, and when this is inhibited, there is a decrease in the reabsorption of the sodium and water. So this is how more sodium is excreted into the urine, and the calcium, it goes inside the cell. So there is hyponatremia, there is a loss of sodium, and the calcium it gets reabsorbed into the cell. Now they are used in the treatment of hypertension, and along with that, these are used in the treatment of heart failure and hypercalciuria that is associated with stones and nephrogenic diabetes and spiders. The toxicity of thiazide diuretics is metabolic hypokalemic alkalosis, increase in the lipids and the glucose in serum, increase in the uric acids. We need to be careful in the patients who have hyperlipidemia or who have gout, or the patients who are diabetic. It can also cause hyponatremia in the patients, and we need to remember one interaction and one precaution with the use of thiazide diuretics is that the NSAIDs, the non-steroidal anti-inflammatory drugs, they reduces the efficacy of thiazide diuretics. So whenever we are using these two drugs together, we need to be careful about the efficacy of thiazide diuretics. Either we change the NSAIDs or either we change the diuretics, because the concomitant use will reduce the efficiency of thiazide diuretics. Next class is the loop diuretics. These are the drugs that act on the DAL, which is thick ascending loop of Henle. So this is a cell from the loop of Henle in which we can see that this is the lumen in which the urine is present. This is the epithelial cells, and this is the interstitium. Here we have. Now there is a transporter which is called as NKCC2. It means that sodium, potassium, and chloride transporter. This is the target for the loop diuretics. The loop diuretics will bind with this channel, and they will inhibit the reabsorption of sodium, potassium, and chloride. And what will happen that all the sodium, potassium, and chloride, it will be lost in the urine, and that's how the body will get rid of all these ions. The drugs included in this group are furosemide, bumetanide, ethacrenic acid, and torsemide. Furosemide, and it is a prototype of these drugs, and this is used in usually hypertensive emergencies, or usually in combination with other drugs to treat the hypertension. It is rarely used as a sole agent just to treat the hypertension. And it has also a role in heart failure and pulmonary edema or severe hypertension and hypercalcemia. We can give furosemide IV as well as oral. And the most common and major toxicity that is associated with the use of loop diuretics is ototoxicity. That is very common with the use of high doses of furosemide and for prolonged times. As it is a very potent diuretic, it can cause hypovolemia in patient, which can further lead to AKI or any other sort of end organ damage. The efficacy of loop diuretics is also inhibited or reduced by the concomitant use of NSAID, so we need to be very careful in this setting. The third class is potassium sparing diuretics. Now we have the last part of the nephron, which is the collecting tubule. So in the collecting tubule, there is a channel, or there is a transporter which is called as ENaC. ENaC is epithelial sodium channel, and this channel is principally responsible for the reabsorption of the sodium and potassium in the collecting tubules. What these diuretics does is that they will interact with this channel, and they will inhibit the effect of this channel. As a result, there will be loss of sodium. However, the sodium loss is exchanged with the potassium, that whenever sodium is lost, the potassium it goes inside the body. So that is why they are known as potassium sparing diuretics, because the rest of the diuretics they also excrete potassium along with the sodium, while these diuretics they retain potassium and excrete sodium. In this group we have spironolactone, epinone, we have amiloride and triamterene. All these drugs they interact with the ENaC channel, and they're used when, in order to prevent the excessive potassium loss, they are given in oral formulation, and the major toxicity that is associated with the use of these diuretics is hyperkalemia. So we need to monitor the patient for this toxicity, or especially if they are using other drugs that also causes hyperkalemia. For example, ACE inhibitors or ARBs, there's a specific toxicity that is associated with the drug spironolactone, which is gynecomastia in men, and it also has anti-androgenic properties. These side effects are very less with eplerenone as compared to spironolactone, but with spironolactone, both these effects can be observed. So this is how the diuretics they play a role in the management of hypertension.